to all of you to another episode of Delhi Dialogues, a series of webinars organized by Policy Circle to discuss important policy matters. Today, we are discussing the impact of COVID-19 on child nutrition. We could say malnutrition has been the toughest policy challenge for successive governments since independence. Child and maternal malnutrition is a cause of 15% of India's disease burden. Obviously, India was not doing well when COVID-19 broke out. Since then, the pandemic has impacted child nutrition and service delivery across the country. The first phase of the latest National Family Health Survey points to a very disturbing trend. The country may be reversing decades of gains in child nutrition. Hello, I am Anil Nair, founder and editor of Policy Circle, and we have a great panel of guests who will discuss the topic today. Dr. Vandana Prasad is a community pediatrician specializing in malnutrition, health systems, and child rights. She is also national convener, Public Health Resource Network. Vinitha Hariharan is a public policy leader. She's on the board of several leading global institutes. She also mentors a number of non-profits working on empowering of women. Kavita Menon is a professor at Symbiosis Institute of Health Sciences. She works on nutritional epidemiology, maternal and child nutrition. Rajesh Mahapatra is a media and policy leader with 25 years of experience. Rajesh is founder director of Odisha Dialogues, a multi-stakeholder, non-partisan policy platform for socio-economic development of Odisha. I wish to thank you all and the audience for joining the discussion today. We will start with you, Vandana. See, schools are yet to reopen, and so are Anganwadis. These are the outlets through which the government schemes reach the needy. Please tell us how severe is the impact of the pandemic, and what is the situation on the ground? Please start your presentation.
Yeah, actually, it seems to me from the conversation that you began that much of what I'm about to say is fairly self-evident by now. But anyway, let me take you through some brief points and then answer your question directly, Anil. So these are all experiences from the ground because, as Anil mentioned, I've been working for over 27 years now on malnutrition. Most of that has happened in rural and tribal areas, but also on construction sites and in urban slums and so on. So let me just try and share my slides. And again, as Anil was mentioning, I think that's better.
Yeah.
You see it now?
It's visible.
All right, great. Yeah. So I think one thing that we all need to know, 2 points from what Anil started with. One is that we were already in a situation of stagnating nutrition in the country. I mean, like NFHS 5 first phase, the data precedes the pandemic, and that was already showing very worrying trends of stagnation. The second thing, unfortunately, is that there's really very little precise data on what's been going on during the pandemic, and I suppose there are good reasons for that. But everything that we're saying, therefore, is largely anecdotal. But there have been reports, like there's one CBGA CRY report that comes to mind. There have been some Vikas Samvad reports that are state-specific to Madhya Pradesh. And Right to Food campaign has brought out a variety of surveys, one of them very, very recent on the midday meals and the Anganwadi services by genres and others. So there is some data which is not, it's not government data, it's not perhaps very precise, but it gives us enough of an indication of what's going on. Now, so there are at least two ways in which, the COVID-19 pandemic is impacting children's nutrition. One is the direct consequences of the disease and the disease process itself, the pandemic. And then there are the consequences of lockdown. And, we've tried to approach this kind of conceptually in this paper that I've mentioned below, Bridging a False Dichotomy in the COVID-19 Response, which is how we think that public health responses should happen to the whole lockdown debate. Is lockdown good? Is lockdown bad? How do we measure the impact of the pandemic itself and so on? So the direct consequences upon children are clearly children themselves being ill, but that's not a major problem for us because we know that now most experts agree that COVID-19 is at worst affecting children in the same way as adults, but much less, probably much less so much less mortality for sure. and also much less severe consequences requiring hospitalization. But having ill parents, so if both parents are down with COVID, as happens, quite frequently during the second wave in particular, then what happens to children, children's nutrition, and so on? Because children feeding and for their nutritional needs, and they need an overall overarching situation of care. And also many children have become orphaned, and that has complicated, of course, their health and nutrition. Now, the consequences of lockdown have been almost as severe, because as Anil mentioned, the basic services, the institutional services available for practically all children have been closed for the last 2 years. So Anganwadi closure, school closure, the lack of general healthcare, which is non-pandemic related healthcare, for simple routine diseases that happen but still kill our children, which is pneumonia, diarrhea, and so on. They have been very severely affected. Transportation to hospitals has been very severely affected. Referrals have been severely affected. Immunization is down. And I think the largest determinant of the whole thing is the level of impoverishment that this community that we're talking about is facing, because parents being out of work, the shift from formal work to more informal work, women in particular being affected much more, and because women are so central to the business of child nutrition, their involvement during the pandemic in care work, in unpaid care work, and informal labor has gone up, and this is really making problems for nutrition. Now, just briefly, the high importance of Anganwadis to nutrition of children. So if most of us recognize this picture, it is basically the life cycle approach to nutrition, and you can start anywhere. So if we start with a small child, I don't know if you can see my cursor at all. So there's a small child in arms. This is, say, the baby under 3 grows up to be a younger child, going to school perhaps, and then an adolescent, and then there's the girl amongst those, the girl adolescent very frequently goes on to become a mother. The mother then gives rise to babies which may be of low birth weight, and this is the the cyclic propagation mission through generations. And you can see, I put Anganwadi, the whole thing, ICDS is basically Anganwadis, that they cater to the older adolescents, pregnant and lactating women, and the children under 6, all the way under 6. And it's the midday meals basically that cater to children in the age group of the 6 to 14 years. And both these services have been closed. So you can imagine that the consequences of food security for this entire cycle of all peoples being affected. So you can see that babies born in this period, for example, would be more likely to have low birth weight, and therefore the impact of that for the rest of basically that whole phase of population growth. So this is a very severe consequence of the ICDS being affected so strongly. Now, the mitigation measures also, I think other speakers will talk about this much more, but essentially it's not that nothing was done. When these services were closed, government did try to put up some measures. But what happened? So it was essentially all hot cooked meals. So hot cooked meals were applicable to children in the age group of 3 to 6 in Anganwadis, and 6 to 14 through midday meals. These obviously closed down. And take-home rations were substituted for hot-cooked meals, as well as some cash transfers in certain states, where state governments also pitched in to give perhaps the extra for cooking. In fact, the midday meal actually put out a directive that even for fuel and for cooking, some extra cash benefits were given. The PDS was expanded, and non-PDS food relief measures were instituted, though not as well in the second wave, unfortunately, which was far more severe as compared to the first wave, very briefly, only for a couple of months, and then people argued for that, and then they came back again. So this has been rather patchy. Now, the problems, the issues with all these measures is that the outreach, you see, the Anganwadi system at best reached to about 50 to 60% of our child population. These are government figures. And pandemic and during the with people being caught in migration and so on and so forth, the outreach was even poorer. And it's very obvious that the most vulnerable got left out. And not only were they left out, but the issues of identity, of having to prove various things through the linkage with Aadhaar and so on, these cause problems for the most marginalized, the most vulnerable. The quality of what was distributed was obviously not as good as a hot-cooked meal. For instance, eggs, which children were getting in large measure through these processes in the hot-cooked meals, they were not being given as take-home rations. Dal and oils, etc., were not given necessarily, not everywhere. And vegetables, fresh fruits and vegetables were obviously not, you were not able to distribute those. So the quality of what they received, it was just basically rice and, in some states, dal also. and the intra-household distribution. So something that was distributed to be eaten by children essentially was then shared by the whole household, because the whole household was suffering from food insecurity and hunger. There would be other children. There would be, maybe elderly, sick, and so on. So it's not necessary that the allocation for the child was received by the child. And specifically with malnutrition, we have seen this and continuing to see this. It's very, very grave that one of the biggest tasks of the Anganwadi system is growth monitoring, to identify specifically children with malnutrition, especially children with severe acute malnutrition, the much heard of SAM, because they are more prone to mortality. So no growth monitoring has happened at all. And that means that the identification of malnutrition is really halted to some extent, and no referral to NRCs. Now, there is some data, the CBGA CRY report in particular, it mentions that as compared to previous years, so this is comparing 2019 with 2020, only 9% admissions to NRCs. So you can imagine what's happening to the rest of it, what's happening to the other 90% that needed admission in the context of already stagnating situation of malnutrition. Where are these children, and what's going to happen to them? And I think the answer is pretty much clear, as the chief of Unicef puts it, and this is Aryan Dawat, who's the chief of nutrition for Unicef, and he says that malnutrition in the country can go up by 10 to 20% due to the ongoing COVID-19 pandemic, and also warned at that time, this was September 2020, that as many as 6,000 children could die every day. An excess mortality of, I think, if you ballpark figures of something like 1 lakh extra children dying in India due to all this happening. And we on the ground are actually seeing this. It's not just from lack of nutrition, by the way, because Anganwadi services also provide safe protection for children. We've seen drowning because we're not, an institution. Children getting in bad ways because they don't have a school to go to. All kinds of things are happening to children. They're suffering in all kinds of myriad ways because of these services being closed. So the recommendations are quite clear from our side, as the Right to Food campaign and the People's Health Movement, with which I have been quite closely associated, as well as practitioners on the ground, that we really do need a rapid reopening of services with care, of course, not in a cavalier fashion, but what that care would really entail is prioritize vaccination of Anganwadi workers and school teachers, make sure that that's documented properly. A very, very massive community campaign to allay fears, because communities are also very reluctant to now send children back. Yeah, it's my last slide. I'm just finishing. Very reluctant to send children back. And really, this conversation that we are having here really needs to happen with them. What are the risks? What is the care that's being taken, and so on and so forth. And we do advocate that we continue food relief for a year, which really should make it as easy as possible for people to access. So therefore, seriously consider, removing the digital requirements of the whole thing, because the digital divide is something that is so very sharp and so very blatant. And really, the government needs to take better care of that. So that's all from me, from the ground, and from our experiences during these last 2 very troubled years. And just a snapshot to leave you with. These are women outside of an Anganwadi lining up to take food. Even hot cooked meals were just generally muted, not really given to children as they came. At least that was happening, and also is not. So thanks very much. I'll try the screen and stop my screen share. Back to you.
Anil, you have to unmute and speak.
Yeah. Oh, thank you, Vandana. You summed up the situation on the ground beautifully. Now, other speakers can ask the questions on the wonderful presentation she made. We don't have any questions now. We will move on to the next speaker. Rajesh, you have any questions?
No, I guess we can move on. And if you're going to invite questions even from the audience, might as well notify them that after every speaker.
Audience can ask the questions through chat box. We will answer your questions after all the presentations are done. Okay, so we are moving on to the next speaker. Thank you, Vandana. I would like now I would ask Vinita to join the discussion. This government, as well as the earlier ones, seems to have launched a lot of schemes to address the issue of malnutrition among children, but nothing seems to be working. I want you to discuss the government schemes and how they can be more effective in addressing malnutrition among children.
Yeah, thank you, Anil, for inviting me to the policy dialogue, Delhi Dialogues of Policy Circle. Indeed a privilege to share the panel with all of you. So my role here is to speak about the government schemes, and we understand that there are a lot of lacunae at the grassroots. There are some, I mean, I would say a lot, but there are lacunae in last mile implementation of government programs. So we would take cognizance of that, but I would just first like to take the narrative with beginning with what the government is offering and what is the problem. First of all, what's the problem statement? Of course, Vandana has already explained it in great detail at the grassroots, what is the problem. So I'll just kind of elaborate at the macro level and then go towards what the government is doing, Government of India, as well as some of the iconic works done by some state governments, and how could we improve the implementation of the outreach? Because as part of my work, I lead a lot of Government of India missions, so I understand what is the practical difficulty in implementation of Government of India programs. So as has been stated by Vandana just now, that the COVID-19 has of course really impacted negatively the child malnutrition phenomenon that is there in the country, and this is because of two-pronged reasons. One is the overburdening of the health systems, which has impaired the service delivery, and of course the economic impact of the pandemic, which has reduced the frequency and quality of meals consumed by the households. And it was also predicted that the child malnutrition could have increased by about 10 to 20% because of COVID-19, and an additional 6,000 children could have died every day from preventable causes because of disruption in health services. So, and food insecurity is not just detrimental to the long-term health of children, but also to their cognitive and learning abilities. So that's taken cognizance of. And of course, the financial constraints have also led to people moving towards cheaper and less nutritious food, as we all know, because nutritious food is estimated to be about 10 times more costly than staple food. And the PDS also, it's just the recent, so the PDS outlets have also been stocking monocrops and staple crops, not giving a balanced basket of diet. So, to which the government has responded recently with the fortified rice scheme, where the rice is being fortified with vitamins and B12, etc. And so there has also been an attempt to stock the PDS with these fortified rice, and various state governments have also taken steps to have a balanced basket of diet, which includes more nutritious food in the PDS outlets. So that has been one of the reactive efforts of the government towards this lacuna that is there with the PDS outlets. And also, of course, as mentioned by Vandana recently, I mean, just now about the digital divide and how PDS outlets also, we have to have the ration cards linked to the Aadhaar. That we understand has created a lot of grassroots level issues in linking the Aadhaar with the PDS, with the ration cards, etc. So for which the government responded with the one nation, one ration card scheme, which has also been pretty effective in terms of reaching out to 24 states and union territories and covering almost 80% of the NFSA, National Food Security Act beneficiaries. And of course, the migrant workers, the first lockdown, we saw the whole the distress migration that was happening across cities towards rural areas, and how the migrant workers couldn't plug into their ration card provisions in their native states, for which again the government responded with the ONORC, and which has been effectively implemented to a large extent. And the other big problem that stares at our face in terms of which indirectly or directly contributes to child malnutrition is, of course, the vacancies in the grassroots level, primary and secondary health centers. So this is the broad layout of the problems that exist at various levels in this scenario. So, but if we just look at what the government of India has been doing, in 2015, of course, we committed to achieve the Sustainable Development Goals of Zero Hunger, towards which the Prime Minister's overarching scheme of Poshan Abhiyan was launched in 2017, which had the targets were to reduce stunning, undernutrition, and low birth weight by 2% and anemia by 3% by 2022. And the large programs were the Supplementary Nutrition Program and the Anganwadi services and the MDM midday meal programs. So which actually have, as data goes to say that it has benefited almost 64 million children in the age group of 6 months to 6 years and 115 million school-going children in classes from 1 to 8. In the recent budget, of course, S&P has been merged with the Poshan Abhiyan to come out with the Mission Poshan 2.0. And so the two main programs that exist today are the Saksham Anganwadi and the Poshan 2.0 with a budgetary estimate of 20,000 crore for 21-22. So that's a lot to look forward to. Again, we have to see how it's implemented and how it reaches the grassroots. And also as the Azadi ka Amrit Mahotsav festival, I mean, the whole celebration towards 75th year is ongoing. And this is September month, which is the Poshan Maha or the Poshan month, where a lot of activities are being undertaken across states at the grassroots level towards improvement of child nutrition, like distribution of nutrition kits, etc. And all of this need not be taken with a pinch of salt, because such festive drives actually contribute a lot in actual implementation of flagship programs at the ground level, because it caters to popular sentiments of the people, and so that it helps improve traction and implementation of such flagship programs. And of course, a Poshan Tracker application has also been rolled out by the Ministry of Women and Child Development, which is going to be monitoring and tracking of the nutrition strengthening approach at the Anganwadi centers and service delivery of Anganwadi workers, as digitalization and encouraging or dissemination of digital platforms is one of the USPs of this particular government. And it's going on, but with a lot of course, implementation challenges, but I think it's going on at a rapid pace. And of course, the closure of Anganwadis has led to a lot of disruption in services, and for which the government responded by provision of dry ration to the households, and also substituting the increased cooking gas benefit by actually direct provision to the children, a direct provision in kind with food grains as food security allowance, rather than transfer the amount to their parents' bank accounts. And of course, Ministry of Child Health and Family Welfare has also issued directions to states on provision of reproductive, maternal, newborn, child, adolescent health plus nutrition services during and post COVID-19. And this included home delivery of IFA and other essentials like ORS, etc. And the recently announced centrally sponsored scheme of the fortification of rice and its distribution under the PDS system for 3 years is also a significant program, which 9 states have adopted, and districts have also been identified in 9 states, and it's going to be spread across the country. And of course, central government has also been, in terms of distributing the diet kit to move towards more value-added foods. There has also been a move to increase the production of millets and introduction of millets in PDSs since 2018. And if we look at some of the iconic works of some of the state governments, we've had the Jharkhand government coming out with the Mukhyamantri Dal Bhat Yojana, wherein subsidized cooked meals were distributed through community kitchens, and the Annapurna Rasoi in Rajasthan, the Aam Aadmi Canteen in Delhi. And of course, Kerala, Uttar Pradesh, Maharashtra, Odisha, all distributing kits and nutrition kits, and also a complete monthly kit to households through their distress funds and various other funds. So there have been these various efforts taken by the central government as well as the state governments, comprehensively trying to address the issues across board. But of course, the last mile challenges remain. And so if you really want to plug the last mile challenges, the answer is to one is, of course, to see how every Gram Panchayat can be saturated with all of these missions that the government has rolled out. There are a plethora of programs that the government has rolled out, Government of India and even state governments following suit. But it has to be seen how every Gram Panchayat or every household can be saturated with all of these programs to cater to every problem that every household faces. So if one does that with a drive and equipping the last mile administrative unit, which is the district, the block, and the Grama Panchayat, with adequate professionals, with adequate human resource, and with the adequate skills given to the officers there to implement these programs, and to also be able to discern what is required to be formulated with all the funds that is flowing into the gram panchayat, the blocks, and the districts. So that is a very essential step required to be done, which we've been saying from the last 20 years. But of course, there are steps being taken by the government in infusing professionals, but it's still a little ad hoc, and it has to be done in a more systematic and institutionalized manner. So there needs to be a cadre of professionals that's created for these kind of grassroots level services. So which would actually improve a lot in implementation of programs at the last mile. And if you specifically talk of nutrition, of course, the concepts like the Nutri Gardens and the zero budget natural farming has to be taken up on a wider scale, which would actually come out with a lot of cost-effective methods of coming up with nutritious food. So that also should be taken up as a drive by the government across the country. So these are some of the methods that we can do to improve the last mile delivery of these programs. So, and I think convergence is the key, convergence of all the missions at the last mile administrative unit, which is the key to implementing programs successfully on the ground. Thank you.
Thank you, Vinita. Thank you, Vinita, for a comprehensive coverage of the efforts of the union and state governments and the difficulties in reaching out to the needy. The last mile connectivity thing, I think that's one part I think policymakers need to look at very carefully, because with all these efforts, we are not going anywhere. So last mile connectivity is going to be the key for the success of ICS and other such programs. Let me come to you, Kavita. The government seems to have done some work towards nutrition security, but even the best performing states, you see problems. You could see a lot of stunting, wasting among children from poorer sections. How can you improve child nutrition in a cost-effective way? Please, give us some suggestions. Thank you. Kavita?
Yes, I'm just connecting actually. Thank you, Anilji, and it is really nice to connect with you all today on the auspicious day of Ganesh Chaturthi. Wish you all a very happy Vinayak Chaturthi. Now, thank you for this opportunity, Anilji, and thank you, Dr. Vandana and Dr. Vinita. You have set the stage very rightly, and it's heartening to hear the scenario of COVID-19 and the childhood malnutrition in India. I was asked to talk regarding the health impacts and strategy to mitigate the effects of malnutrition. Now, let me connect and take it to you, because the stage is already set. There is no need of introducing the topic again. So I thought it would be really nice to connect to the famous Unicef conceptual framework of malnutrition to see how are we doing. At the same time, how COVID has impacted and what could be the potential effects that we are going to face, not both short term and long term. Dr. Vandana mentioned about the direct consequences, which we are obviously facing now, but in the long term, we are to bear the serious consequences. So we know that COVID has disrupted the country economically, food-wise, as well as health system-wise. Now, if you look at this UNICEF conceptual framework, you would see that there are 3 layers of causes that we identify as risk factors for malnutrition in children. The basic causes is thoroughly disrupted by the COVID-19. Not only that, that has actually implicated the underlying causes at the household and family level. And now we will see that together it is actually leading to the other level, that's the immediate causes. So this continuum, right from the basic to the immediate causes, actually has raised several issues related to malnutrition. We were as a country, we were improving with respect to the levels of malnutrition. We were doing good, in at least much better than many other countries. But what we are now to think about is we have the triple burden of malnutrition, which is exacerbated by the COVID-19 pandemic. So we have non-communicable risk, our risk for non-communicable diseases, undernutrition, as well as the micronutrient deficiencies are going to be exacerbated, keeping in mind that the most importantly, the disruptions in ICDS network as well as in the midday meal programs, which was found to be very, very beneficial for our children, especially in mitigating the food insecurity in a child's life. Now, how does it relate to the future? We have a lot of intergenerational effects that we could see, given that our younger children, our young population is malnourished, right? And then an early bearing of an early childbearing process actually add additional burden to the intergenerational consequences. We all are very familiar with this picture. Now, let me bring it to you all in a different perspective that the COVID-19, we are talking about childhood nutrition, which comes around where we are talking about the immediate and long-term consequences. And immediate, we know that malnutrition in different forms, such as wasting, stunting, and then underweight is rampant. Although the estimates are quite variable across the country, you will still see that this has a big impact on the child's intellectual potential and reduced school performance. Schools are closed. It's actually the parents who are learning now rather than the children. And you can see that this is largely affecting their performance as well. Now, together, it actually leads to an intergenerational kind of an effect where we can see that this persists, the malnutrition, childhood malnutrition persists in adolescent malnutrition. Now, once our adolescents are malnourished, you will see that they have a higher risk. Actually, they put a higher risk of having the intergenerational effects perpetuated through the continuum of pregnancy, lactation, and childcare. So here you will see that this act, because around 40% of the rural population, the children get married between 15 to 18 years, and you will see that they are not still fully grown to conceive a baby. And a lot of unplanned pregnancy occur in an Indian scenario, which actually predisposes them to early onset of adult origin of diseases for their progenies towards 30 or 40 years of their adult life. So obesity, abdominal obesity, diabetes, cardiovascular diseases perpetuates through the life cycle, and the lifespan of these individuals are affected. Now, in turn, the young adult population being sick is actually affecting the economy and the productivity of our country. So if we put it right, we should say that we would consider that the child malnutrition at some point we need to stop, and the government had put a large program in terms of Poshan Abhiyan, and wonderful work was being ongoing, but the COVID pandemic has put it in a reverse gear, and a lot more efforts would be needed actually to strategize and reorganize the entire areas. So, as a public health nutritionist, what I would perceive here is the mitigating strategy should focus on data-driven approach. Of course, we require very strong data-driven approach that should enable a strong focused country leadership and efficient financing and effective partnership. Without this, we are not easily going out of this COVID pandemic scenario and the childhood malnutrition. So what we may consider, or what we may need to consider essentially would be, first, we need to look into the context-specific food security interventions. So here, what we need to do is improve the food system approach to mitigate the challenges of malnutrition in different layers, be it in the farming system, the community approach, be it in the supply chain management, and getting these foods right to the vulnerable population. This is something very, very important, and that actually mitigate the immediate risk of food shortages. The second would be ensuring that social participation protection programs. Now here, what we require, as rightly Dr. Vandana and Dr. Vinita has put it in perspective, we have to do more actually in this area when the midday meal programs as well as the ICDS programs, which are actually the main programs to take care of children, we need to improve this. We need to reopen as well as start functioning these programs. Apart from that, the opportunity for payment deferrals, which already our government has implemented, which actually might be helping the vulnerable, the most vulnerable, in getting some cash support programs as well as some tax breaks and so on. Now, the third important aspect is if we realistically look very closely into the access to healthcare, we would see that the marginalized households had poorest access to healthcare system during COVID-19 pandemic. And at the same time, you will see that many of these households in rural areas and urban slums were actually not having at all any kind of access. All the main healthcare delivery centers were actually poorly functional, and even if they were functional, the access was limited. We need to actually deploy our community health workers more strongly to deliver vaccines, nutrition supplements, health and nutrition education, and even support the women of reproductive age with assistance in newborn care, and also encourage the rolling out of community-based management of malnutrition. This is something important. We shouldn't be looking only for a kind of volunteer kind of work here, but rather they should be paid and incentivized so that they can do a wonderful job in this kind of scenarios. Now, apart from that, the women in the community as well as the community health workers can actually come up with delivery of health and general education. This would actually help to keep off all the fears related to COVID, that people are not coming out much even in the rural areas. The moment you enter the area, they were very suspicious whether you are bringing COVID to them, and there is a kind of a silent resistance, I would say, when you go meet them and discuss on different aspects or do any kind of research-based data collection. This needs to be addressed, and the women in the community should be mobilized to improve the scenario. And also, we can have more safe and healthy household and community environments, having adequate safe water access, appropriate sanitation and hygiene practices, and infrastructural support to households and communities is the need of the hour. My personal experience in this is that I don't see many people wearing a mask in the rural area or in urban slum. The moment you ask, you will see that they actually say, oh, these are, if God willing, we will get it. If not, we won't. So there is a kind of lot of education and the practical approach that is required here to sensitize the communities regarding the aftermath of COVID-19, as well as to improve the childcare practices, which has gone for a toss now due to the COVID pandemic. So to summarize here, what we will require is governments, donors, development partners to re-strategize and reappropriate the investment in the post-COVID era, and also again stress on the data-driven approach in decision-making and a political clout and will, commitment and support from international community. This may help us to improve the scenario, but many of the case studies, what we see from other countries like Russia, Netherlands, or even Nigeria, and many other low and middle income countries, we can showcase that these approaches have been successful. So why not India can test some of these and improve the scenario? Thank you.
Thank you, Kavita, for the detailed presentation on strategies to mitigate the problems. Is Rajesh around?
Yeah.
Yeah. And now, Rajesh, you heard all the speakers. They covered a lot of ground. Can we see food security or nutrition security in isolation from the prevailing economic situation? Can nutrition schemes succeed without an effort to address poverty and income disparities? I want you to, as an economist, I would like you to address this question.
Thank you, Anil. Thank you very much for choosing to have a dialogue on this very important topic. I split my time between Odisha and Delhi these days. I have been here now for the past 2 weeks, and every day I look up the newspaper and I read the headlines about concerns around school reopening. And I see in a metropolis like Delhi, the concerns center around how safe the children going to be from COVID. And then the other concern that kind of pops up is around mental health illness. Very little you get to read in the newspaper here about what we say, the triple whammy that our children have had to face through the pandemic, and the third leg of that, which is nutritional losses. I'm therefore thankful to you to have chosen to discuss the issue, because I think this issue needs to be center staged. Center staged primarily because the kind of numbers that some of our previous speakers have brought up, and some of the reports that have come out recently, mostly you see them coming from international agencies, and there are a few Indian agencies also have come up with reports, but I think firm data is yet to be compiled, and I'm pretty sure when they do get compiled, we would get to learn of a reality that is actually much more worse than what has been feared in reports that have been published so far. Very recently, I am associated with an organization called Forum for Odisha Dialogues, which is also a thought leadership forum. And Dr. Vandana Prasad was there recently. We had picked up this topic of reopening of Anganwadis and resuming ICDS programs. And some statistics got shared there, which were actually a survey done by the Regional Medical Research Center there, which is a government outfit. And some statistics from there kind of corroborate what Vandana earlier mentioned. We had in that report, and that was based on a survey between March and August, that there was a 18% fall in immunization in Odisha during that period, during the pandemic phase. And mind you, in the first wave, Odisha was much less affected than most other states. Despite that, there was an 18% fall in immunization. There was a 9 to 18% fall rise in acute illness among children. And there was a 7% increase in malnutrition. And I want to reiterate the fact that Odisha was seen as a state which was probably amongst the least affected during the first wave of the pandemic. This kind of supports what Vandana mentioned about the UN report that kind of projects 10 to 12% increase in malnutrition, which, as the UN reports have cited, may increase as the pandemic prolongs, and we still do not know the full enormity of it. We have yet to experience. I was actually alarmed by the statistics Vandana shared from that report, which actually works out to the children deaths, 6,000 daily deaths, actually works out to almost 2 million additional child mortality. It's not 2 lakhs; it is 2 million actually. If I got my maths right, and that's alarming. If 39 billion meals missed is the statistic that UN has put out for 2020, and if one were to safely take a ballpark estimate of 25%, a quarter of that being in India, that would mean anything upward of 30 million children have missed midday meal scheme. Now, we know that there have been attempts to substitute that with dry ration supply and all, but we also know that the dry ration supply thing has not been a real answer to the problem, because there are various issues about targeting them, about how inaccessible demographics have not been reached, and how at a broader level there has been much less provisioning for dry ration than what would have been the case with midday meal scheme. And more importantly, there is the issue of intra-family distribution that came up during the panel discussion, and which is a reality to face with, that this dry ration made their way to family homes, which had seen significant income losses and significant shortfall in availability of food at a household level. So there are consequences of that. I benefited from what Vinita had to say about one takeaway from there in terms of way forward was that lots of reforms are still possible at a state level, and instead of waiting for any grand plan at a national level, states should take up how at their own level they can intervene and find ways out of this before it gets worse. Now, a few words of caution. There is a lot of talk that is happening now about, I'll kind of come to the bigger issue, whether we take refuge under fortified rice, or whether we talk about social protection programs, the context-specific food security interventions that Kavita mentioned about. I want to now kind of take this debate a little out of the narrow channel of nutritional security among children being seen as a challenge that can be remedied only through social protection, or what we call social security support schemes. The question that I want to raise, can you really look at, given the enormity of this challenge, and we know what kind of impact it's going to have on intergenerational inequity. You also shared statistics about stunting, wasting. Those numbers are only going to get worse. Can we look at nutritional security in isolation from the larger political economy of food security? Now, there are some serious concerns cropping up there. What actually determines food security? And there is, I think this is the best time. I was thinking about your topic yesterday, and the book that came to my mind, I just pulled it out from my shelf. It's a little jaded, old now, Hunger and Public Action. The seminal work by Zondres and Amartya Sen. I think there cannot be a better time to revisit this work. I kind of glanced through it, and I just related that all the concerns that was being talked about, this was a 1989 publication, how they have come to life again after nearly 30 decades. In these 30 decades, we made a lot of progress, and we made a lot of progress because of both what one could call growth-mediated protection and social security or support-mediated protection. Government providing a lot of entitlements, largely the state providing a lot of entitlements, and the general economic upliftment and economic boom that we saw starting somewhere from the mid-90s, with a little pause in between, and then again resuming in the first decade of the millennium. Now, this entire reversal of the progress done on the hunger front from 2014 onward has been largely attributed to economic slowdowns and economic downturns. Climate extremes, conflicts have also been cited as other reasons, but primarily it is the took away the growth-mediated improvement in food security that you saw in the 2 decades preceding that. And this was happening already before the pandemic hit us. Now what? And also an economic downturn and an economic slowdown also shrinks the capability of a state to intervene, both in terms of resources and in terms of prioritization of welfare measures. And we also saw that happening, particularly in the Indian context. It is important to note that while we talk about various interventions, efforts such as Poshan and all that, a lot of renaming and remerging of and rechristening of schemes have happened. But the reality is that the Indian government started spending less and less and less from 2013 onward. Each year, it has spent less and less and less on all of such programs that were intended to improve food security, that were intended to counter malnutrition, that were intended to counter undernourishment. That's the reality. And we need to confront that. So we need to understand the political economy of it, that we went through a phase where there was a retreat of the state. And that retreat of the state was actually going to prove very expensive and destructive to the gains actually we had achieved on this front. Okay. Now, do I have 5 more minutes, Anil?
Yeah. Please.
Okay. Because I need to explain this. So now, when the pandemic hit, what happened? Now, we have studied in our classic literature that a food crisis occurs when access to food goes away. When, if you were to borrow the old classical example, when people lose purchasing power to buy food. Now, people would lose purchasing power to buy food if there is a loss of income, or if there is a significant spike in retail food inflation that makes their access to food no longer there. Or you could use a term, collapse of exchange entitlement, which is a market-driven entitlement that someone like Amartya Sen would try to use. That when there is a collapse of exchange entitlement that happens, you end up in a situation of a food crisis. And that's exactly what happened with this unmindful lockdown that was announced in the month of March, April. There was a sudden loss of income for millions of families. And we did have a huge crisis. 6 months down the line, when certain organizations brought out a report called Hunger Watch, it demonstrated that 2/3 of the marginalized population in our urban centers reported that they got to eat less or somewhat less or significantly less from what they were eating earlier. It also turned out that urban hunger, incidence of urban hunger, was 15 percentage points more than rural hunger. At Odisha Dialogues, during this period, we conducted a survey in 8 blocks of southwestern Odisha, in Kalahandi, Koraput, and Balangir. And we found that as part of coping strategies of returning migrants, that's what we were trying to study. And we found that most returning migrants reported that they were cutting on their food intake in order to cope with the loss of income that they have had, right? So there is the exchange entitlement, market entitled exchange entitlement. There has been a collapse or destruction of that has happened. 2, the state-provided entitlements, direct and indirect, that support food security. Things like ICDS, things like an efficient PDS. Although an effort was made to allocate more, your food subsidy bill went up by almost 100% in 2021, but that was still not enough to offset the impact of the income losses that a lot of marginalized families had to cope with because of the lockdown and the economic slowdown. So then you had the school closure, you have talked about it. Then the indirect support, things what Kavita mentioned about access to healthcare. Whether it is your vaccination program, whether it is safe drinking water, whether even in urban center for children, a play field for a place for physical activity. You have ended up with problems of obesity in other places, right? So all of these things, the absence or withdrawal of state-supported entitlement caused an issue. So now, therefore, the question to ask is, can you really talk about nutritional security without paying attention or without taking note of what is really happening to food security at a broader level? And this is what the state today is, that the food security situation in India has gotten severely worse. It is much less reported now. It is really, in the early months of the lockdown, there was a starvation death in Odisha. Not a single media outlet first took it up. Afterwards, a few took it up, but there was no hue and cry. But we visited that place. We visited that lady, Dukhi Jani, a tribal woman who died simply because she was a single woman and there was no support. And she just fell drop dead one day because she was going hungry. Okay, and yet it was not registered as a starvation death. So you will not hear these reports, but they will keep coming up. Now, what are my concerns, and why I'm saying that this discourse has to be linked with a wider discourse on food security is because of this. There are a few other developments that have happened during the pandemic, which is, we think the corporatization and commercialization of agriculture has been pushed big time. Now, that has got its implications for food security. And why do I say so? Because food security, to begin with, we need to have food self-sufficiency. Now, I do not know if you are aware of this fact. It is only in 1992 India attained food self-sufficiency in the truest sense, meaning it started producing enough food grains that were enough to meet the nutritional requirements defined our poverty by our poverty line. It was only in 1992 we reached that state. Okay, and of course after that, we have done reasonably well on the food grain production front. We have reached record production of 297 million tons. Yet we still cannot ensure that every household gets enough for the food grain that it needs. Food self-sufficiency is the first condition. The kind of policy changes that are happening now in the agriculture space, the fact that for many, many years we are really not making any major breakthrough with productivity relating to major crops are certain sources of concern. We might be doing fine now, but in the longer run, there are concerns. Now, does food self-sufficiency mean you will be food secure? No. First, you have to have food self-sufficiency. That has to translate into availability of food. When you talk about availability of food, then you talk about access to food. Now, availability of food or access to food, inter alia, in an agriculturally small agriculture dominant country like India, is decided by how you produce that food. Who produce? When a farmer produces that food, how much of that food actually he's going to own if he has to consume it for himself. The kind of tendencies, policy changes that we are now seeing under the, pretext of the new farm laws, the commercialization, corporatization, there are some serious threats that are looming large for small agriculture, food security among families that are dependent on such small agriculture. So that's the other thing. Now, the last point that I would like to flag that we cannot take our eyes off is what is happening to retail food inflation. Now, retail food inflation, by all statistical agencies monitoring prices today in the country, is grossly underestimated. There has been a significant spike in retail food inflation, and through the pandemic years, that has exacerbated more than before. And there are concerns that some of these inflationary breaks that we have seen might actually be structural in nature, in the sense they might not go back to the previous levels. And this spike in retail food inflation is actually making food inaccessible to a lot of people, let alone nutritious diet, which is no longer accessible to a large population in the country. So we need to bear these things in mind, and we need to come to a state where we call the spade a spade and say, look, we need to address these very fundamental and basic questions before we can go over to specific program-based interventions. Thank you very much.
Thank you, Rajesh, for that long presentation. Vandana, I want to come back to you.
Did I overshoot my time?
No, it's okay. Vandana is smiling. Okay, Vandana, I want to come back to you on two of the comments you made in the chat box. One is about Thailand, example of Thailand. How did they manage? No, what is the example? What is there to learn from Thailand, from countries like India?
Yeah, there's a lot to learn from Thailand. I think that they showed a very dramatic kind of bringing down of malnutrition within a very short period of about 5 years or so. So it started with political will, which was the main thing. Their king, their queen, their most senior leadership was absolutely obsessed with food security and talked about it all the time and like pushed for it all the time. Thailand anyway is a country with a lot of street food and a lot of decentralized ways of food security being managed through low cost. So that and their community health worker program. So full systems approach all the way, the speaker from Symbiosis was mentioning this is very important, but all the way down to community health workers and volunteers at the ratio of 1 volunteer to 20 households. So, very intense program at the community. But not just left alone, not like our Asha program. You dump everything on an Asha and you tell her to do everything and you just leave her without any systemic support. But here it was fully incorporated, integrated into a whole system because the leadership was so willing to do that. So I think it was a very comprehensive, very well integrated system, all the way from the highest possible political will and leadership. The health system was very well integrated into the whole thing, all the way down to community health volunteers at a very intense level of 1:20 households. So that's how Thailand basically succeeded. Yeah.
I have another. You had another comment on excess mortality. Is there any calculation, any estimate about the share of deaths due to malnutrition and starvation?
No, so that's what I was trying to say, that this was just a quotation of Aryan Vart in a particular phase. I suspect it was during a wave phase when he said 6,000 deaths a day. I don't think it translates into that many. There was also another computation on the basis of this 10 to 20% increase in malnutrition and 3/4 of all mortality being linked to malnutrition. So that computation was, giving us a figure of much more modest figure. But I think excess mortality on the whole for the population is well understood, and statewide we have seen those. It ranges from 40 times in Madhya Pradesh. I mean, that's really pathetic and really disgusting to see that kind of data shortage that we have on deaths. In Delhi, it is something like 4 times, or like something small, much smaller. But overall, all India figure is 8 point some percent. I think Rajesh can correct me on that. So of that proportion, some would be children, because this is overall mortality, but we really don't have any specific figures at all during the pandemic. So that's a problem.
See, our chat box it has more comments than questions. Srijit, are you there? You talked about how to eat, educating people on how to eat and what to eat. Is this a solution, kind of solution for problems we are facing? Srijit, if you're there, you can speak.
Hello.
Hi.
Hello.
Yeah, I can hear you.
Hello. Yeah. The thing is that the education plays a very important role. What all pulses, what all grains which we are giving, At least even that can be eaten by the methods of sprouting, etc. I think that may such education has to be, such messages has to be percolated down to the people. I think that may be that's very, very important, because even when we say the so-called educated people doesn't know which sort of fruit will go match those things. This even educated people doesn't know. So I think government can formulate a policy in the way the local people can understand. Hope you are getting my point.
Okay. Yep. Okay. Anybody? No. Kavita, you want to comment on that?
Actually, there are multiple programs, that nutrition education and awareness programs, the various NGOs, educational institutions, and agencies do actually. But what we require is not a kind of one-off kind, like you go do an awareness program and you come back. A strong behavior change work, communication as well as strategy is something that is very essential if we really want to go back to our balanced and traditional diets, which were very diverse and very healthy a kind. And the change in the pattern of food consumption from what we eat, what we used to eat in the older ages, earlier stages, and now what we eat, and also the level of refining and the processing that is happening for the foods. All this have to be relooked actually, and we need to consider this the changes that has taken away the nutrients from the foods. This is something, a priority to look into, no matter the food industry, the a nexus between the food industry and the government and also the policy makers is something very essential if we want to address these issues. Just having a tax on sugar, just having a tax on things may not work for India, but because we have a very large population and people hardly understand at the grassroots level what this tax means to them. So there is a lot of educational activities and behavior change communication. It has to be really critical and crucially presented so that people can start thinking, making a change in their lifestyle.
Vinita, you want to comment on this?
Yeah, so the awareness aspect which Srijit raised it's quite critical. Like I just mentioned of the Poshan Ma and such kind of festive drives, I think plays a large role in increasing outreach of government programs. Like if you take the example of the Swachh Bharat mission, although a lot of people have criticized saying that the toilets are not being used, etc. But whatever said and done, it has increased the the construction of toilets, and every almost, I mean, more than 90% of households have access to toilets. But there was a huge drive, and there was this efforts of outreach, and there was a lot of focus of the government on that program. So I think similarly, even nutrition and such aspects need to come to the limelight with a lot of trust on last mile awareness. And like Srijit mentioned, I think education at last mile plays a key role.
Okay.
It can be done in very, very simple local languages, which can be understandable to the very local people. That's the way it has to be. It has to happen. Like in local radios, not in big TV channels and all.
Right.
Then only the people can, the common man can understand what is the importance. Just like what all food, like vitamin C, when you're giving with iron, it will fortify the absorption of iron. Those messages has to happen. The importance of vitamin D and calcium.
Thank you, Srijit. Dr. Anthony made some important points.
That's all. Okay, sorry. Okay, thank you.
Sorry. You can go on. I thought you stopped.
Okay, that's all. Thank you. That's all. I'm just putting the point. Okay, thank you.
Thank you. Dr. Anthony made some important points on PDS, the focus of PDS on rice and wheat. He talked about the missing millets and pulses in PDS, this PDS system. So, Dr. Anthony, would you like to comment on this?
Can I come in? Okay.
Yeah, please.
Let me just immediately react to that messages. We have got content specific, very strategic messages like calorie densing, the utility of adding 1 or 2 teaspoon of oil in whatever chapati or semi-solid food from in complementary feeding, 6 months to that 15 months window where the malnutrition sets in. We have failed miserably in it. In spite of 8 lakhs more Anganwadi centers, we haven't driven that home very well. We don't need print media. We don't need maybe TV, some messages it has got. But even through Anganwadi worker, the calorie densing idea hasn't filtered down effectively, number one. Number two is as I said, the very simple thing like sprouting, how it adds nutritive value. We have failed in that sprouting, and as a habit in some places it is there. We need to southern Karnataka, and sprouting as part of the thali meal is sprouted pulses is a part of the dietary habit. In other places it need to be. Green leafy vegetable, what we need is on iron absorption. Bioavailability is less, but we have to have a tangy food like vitamin C source. Anything, even tamarind will do. We have not done that. The other one is amylization. There is, by and large in South India, the fermentation is part of the appam making or whatever, idli, all those things where the food is carbohydrate rich, cereals are fermented and it adds nutritive value. That we have not failed. So these are the messages which we have not driven home much. Okay, that is one comment. Second thing I wanted to say is that there is a misunderstanding in our conversation. We want to, the government is worried about starvation, death, and famine. So for that, you need food security. So that food security is hunger remission. So you only push only cereals. Whether wheat or rice, we forgot anything. We forgot that what is the word meaning of nutrition. Food, cereal is not nutrition. We need cereal, pulses, and oil. That's why in the PDS, if at all, its PDS is for not to prevent hunger, but to improve nutrition in the Indian growing adults and even adults growing child and the adults. You need to add oil and pulses as a package, and even the cereals. Allow for diversification and local procurement and distribution. We don't have to go from Karnal and Punjab. The whole wheat doesn't have to go every part of India. We can have local millets. So many tribal pockets, the Deccan Plateau, Marathwada, all these millets are disappearing. We need to nurture and preserve that. And PDS also, the government is proclaiming that it overspend on food subsidy. That is only in the procurement. It hasn't reached the post-COVID hungry, starving families. It doesn't result in distribution. So it doesn't reach the family ball. What is government doing? In 25 years, we have not managed to correct anemia through iron folic acid, in spite of all the distribution. So there are reasons for, because anemia is not only due to heme. Anemia is not only due to iron deficiency. Iron is one component. You need protein to form the heme. Hemoglobin is formed by that. So we need a mix of food of protein, iron, vitamin C, copper, or so many micronutrients. That comes from the mixed diet in the family. So these are my comments. In the PDS, PDS is at present is only a food security, aiming food security. It is not aiming nutrition security. Let me comment on that Vandana's narration of Thailand. Thailand, I've been in Chiang Rai for an international conference on vitamin A, and I found the princess, she's a doctorate, princess of Thailand, is a doctorate from Cambridge on nutrition. So she heads and supports the entire technical group's push from my idol university. It is not some political leaders taking decision. With regard to nutrition and health, it is the technical body. I wish India changed to that. Thank you.
Yeah, that is no. Thank you, Dr. Anthony. No, Thailand. No, because it's very important that you highlighted the example of Thailand. do we have some other global best practices, to follow?
Thailand.
Apart from Thailand,
Thailand is one thing is our equivalent to the health subcenter. It is never a health subcenter. It is a health and nutrition subcenter, and also birth spacing and family. So it is an integrated. Now here we have got a ICDA separate, Anganwadi and health center. Thailand has got a combined model, and it is almost like a mini hospital like our health and wellness centers. Also it is nutrition, also birth spacing, everything is together. So that is one good thing, and it is a lower budget, but it has got ensures an availability of quality services with regard to the health department, the nutrition department, and family planning and other, all at one go in the community level. That is one thing good about Thailand.
okay, I would like Rajesh and Vinita to comment on this, integration of health and nutrition programs. Is it possible in India? I want Rajesh and Vinita to comment.
Rajesh, you want to go ahead?
No, go ahead.
I think you start.
Go ahead, Vinita. You work more closely with the government, so you would be in a better position to say whether it is feasible or not.
Yeah, so absolutely. So I agree with Mr. Anthony that the nutrition programs that he mentioned, he mentioned about an ideal basket that is required for a family. So I think these kind of messages, if it is done at a very grassroots level, like mentioned by Srijit, also in the vernacular languages, and I think that is something that we really need to intensify, especially the last 2 years. We've lost a lot of time in the pandemic, and a lot of digital messages being passed out, which really don't reach a lot of people. So outreach measures needs to be more creative and more innovative, adopting a lot of local methods like community radios, vernacular messages, and of course the local television channels, the cable television also. And of course, now the great WhatsApp University also makes a lot of difference in spreading messages across. But I think there is a need to really educate people about what is actually healthy, balanced diet. So many of us also may not know actually what exactly is a healthy, balanced diet. So I think that kind of messaging really plays a lot of, it plays an important role. And as you said, combination of health and nutrition, I think it's very important. We are still actually looking at, fulfilling our basic needs. Even today, in basic needs and health are still being met in terms of deficits in primary, secondary, and tertiary health centers, filling the vacancies of the staffs, etc. But when it comes to these value additions in terms of how to improve the reach of programs, etc., I think there's a little bit of neglect there. So if nutrition is combined with the renewed trust that health is received now post-COVID, I think that will make a lot of difference. And also focusing some amount on alternate systems of medicines as preventive measures, I think that will also play a great role.
Rajesh.
Yeah, see, you can combine anything with everything, or anything with anything that, we have seen it. Now, in my home state, for instance, I have seen that a lot of the nutrition programs are now being pushed through, there's an attempt to bring a lot more, synchronized mission Sakti, what they call, which drives the self-help groups of women with several nutrition programs. And they also, where people during the pandemic, we were pushed to grow vegetables, which kind of became an alternative livelihood source. So the point is not, not about how to do it. The question is, why are we not able to do some things? So that's where I've been trying to emphasize again and again that the markets cannot address the issue of food security, whether it is nutritional security of your children, whether it is food security of the disadvantaged section, or whether it is hunger in urban centers. The markets will never be able to address that question. the state will have to be there. The state will have to be there very actively. Two, the question of, I think I just want to take on from where Mr. Kolanur left. We talked about community-based participation. One of the best, you cannot mobilize communities unless you also respect and acknowledge their own traditional wisdom and knowledge about food systems that they have been used to. So I think there is merit in this argument which Mr. Anthony Kolanur put out, that there is a need to diversify our food supply intervention programs by looking more at locally grown things that are part of traditional diets. I can say that there is a program that was started in Odisha called Odisha Millet Mission, exclusively, and it is now, after 5-6 years, it is yielding some positive results. Now there are two ways you can do it. You can make your own procurement network, and I don't see any reason why, beyond FCI, why the civil supply network of a state government cannot go into procuring things. They can. Of course, it's a question of finding resources. Okay, but there are many ways to also encourage the, let's say, millets, for instance. Now, in Odisha, in several schools, they have started, in Anganwadis and preschool, they have started introducing millet laddus. That's a healthy diet, part of the healthy diet. That's the traditional diet. And that inter alia encourages millet production. So you can create incentive structure for crop diversification and supporting a diversified food basket. And I take that point. I think it is, we do have a lot of diversity in our food system, and we need to sustain that, we need to encourage that, and we need to carry through that. I just want to make one clarification to Mr. Anthony. The food subsidy, the food subsidy did go up significantly last year. It actually went up from 1,15,000 crore to 4,33,000 crore. You are right, almost 2 lakh crore of this was actually loan cleaning up the FCI's balance sheet, loans FCI owed to the National Small Savings Fund. Yes, that it did not actually translate into distributing food worth 3 times the food budget that was there, but it definitely still, from 1.15 lakh, my sense is the total budget was almost 2.5 lakh crore, and this year also the provision has been there for 2.4 lakh crore. What I was trying to say, that even that is not enough. That has not been enough given the crisis that we have had on hand, and there is need for the governments to spend more in terms of supporting the food needs of our people in these years.
Thank you, Rajesh. Vandana wants to comment. Please go ahead, Vandana.
No, I actually just wanted to support Rajesh's view that, finally it is a question of macroeconomics and what investments are being made by the country, and those are dismal. They're absolutely dismal. And within that, I think, in Rajesh's very important presentation, I think, but one point that he didn't bring up, which is extremely important, is the point of inequity. I mean, look at the differentials between the top and the bottom quintiles in terms of money, just simple poverty, and that is just going up. Other countries are bringing it down. In ours, the gap between the rich and the poor is only expanding and expanding, and has expanded bitterly through the pandemic. I mean, like corporations, it is well demonstrated how they have made profits during the pandemic, at a time when practically the majority of people have lost their entire savings, also have had critical impoverishment. So I think that really calls into question the whole paradigm of economics that we're following at this point of time. There have been cuts in budgets for all these schemes, ICDS included. I spoke mostly of the Anganwadi. It has suffered a cut in budgets that has been very cleverly manipulated to show as though it's been an increase. Now, why? Why should the government try to pull wool over our eyes? If we are all poor together, let us try to find the best ways of using our money. But who are we trying to fool with cutting back on all the social expenditures? So I think that the issues of social injustice, I mean, we should not couch it like Rajesh also said, that let's call a spade a spade. There's a huge amount of injustice going on in this country in terms of the inequity. That's 75 years on. It's almost intolerable. to see people dying of hunger like this, and children not getting anything but rice to eat. And in answer to that, I also want to bring up the point of mandatory fortification. There's a lot in the chat box about it. That our answer to this, we are, in a webinar, we are speaking all of food diversity, natural diets, our good old diets, and so on and so forth. But as a country, we are investing in what? In just rice fortified with chemicals. Like, where look at the disjunct. Everything we've said from beginning to end today is about food diversity. And yet, what is the policy that the government, and we will not reject that policy. We will say it's a very good thing, very good thing. It is a chemical fortification of rice, meaning poor children just keep eating rice, but we will put some chemicals in it. You're never going to get a fully diverse diet. 10% of our children only under the age of 6 get a dietary, a diet that has some quality in it in terms of diversity overall. I mean, so shocking and shameless. I feel very agitated. I want to stop now. But I really feel that as experts, we've got to speak up. This cannot be only something that is done during webinars and seminars when we speak of good old days and a rich plate of food. But when it comes to policy making for the poor, we just say, oh, it can't be done. It can't be done. Diversity can never happen. Diversity can't happen. So let us do mandatory fortification instead. And there's been quite a lot of support in the chat box for this view also. Anthony and others, we are agitating on this front in many different ways and trying to raise issues with FSSAI, not getting too far. I urge the technical experts to kind of really consider this.
Anil, if you have a minute, I think we are almost coming to an end. I wanted to say something which I forgot. I mean, can I?
Yeah, sure.
No, I'm glad that Bandana pointed out that I did have it in mind when I was talking about retail food inflation. I did want to talk about inequity and how that growing inequality and how that affects. But now that she has said it, I wanted to say something which actually closer to the profession that you and I belong to. I forgot because I started off by saying this is a good time to revisit hunger and public action. And one of the biggest contribution this book made, it kind of told us that when we say public action is not about only what the government can or should do. Public is a much bigger notion that is taken here. It is about through. It is about individual intellectuals. It is more importantly about the media. Okay, they can actually sensitize people. They can talk more about it. And the times that we are passing through, where we see that endemic hunger has returned to India. Endemic hunger has returned to India, but endemic hunger hasn't returned to our headlines. I think the purpose of webinars and dialogues like this should be to center stage the issue of hunger and why we should be talking more and more about it.
Yeah, thank you, Rajesh. Any other speaker wants to comment on this? Vinita, Kavita? No? Anyway.
Yeah, I would like to add something here, Anilji. I absolutely share my voice to raise my concern against this rice fortification. We are going to have more challenges with excess intakes of these nutrients, and already we have the case studies from different countries, and we are knowingly going into another kind of a challenge, health challenge, where we are going to have more adverse impact on NCDs. This is going to be another upcoming challenge for medical professionals as well as even for the nutritionists to address. Nothing can stop this unless government thinks about it. And already our wheat is fortified. We have oil that is fortified. We have milk that is fortified. We have fruits that is being fortified. Now, where are we going with rice? And rice is something, the quantity is never measured before you consume. You just scoop it out, and how much of it falls into your plate, the person eats. And this is something very, very important to consider, unlike a chapati being coming to your plate where numbers actually help you to control. But rice is something beyond that. It is important to address this issue.
Thank you, Kavita. And thank you also, Vinita, Rajesh, Vandana, Anthony, Srijit. Thank you all. You have contributed a lot. No, actually, it was a very passionately argued webinar. I'm not used to this. Very good. The thing is that when I tell people, when you have 10 minutes, I expect them to overshoot it by 5 minutes at least. So Vandana made a very interesting comment. I liked it. Thank you. Thank you, all of you. Thank you. I want to thank the audience also. Thank you for being here. And this is all the time we have. And have a good evening. Have a good day. Good weekend. Thank you.
Thanks very much.
Thank you,
Thank you all.
Anilji.
Yeah.
It was
Thank you,
wonderful.
Anil. Yeah.
Thanks.